What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. Today, I have a doctor that I do not hesitate to refer to. If I needed a dentist in that part of the world, I know who I would go to. So it is my honor to introduce everybody to Dr. Preeya Genz. Do I say that right? Is that how we say it, Preeya?
Perfect.
Oh, look at that. I am already starting off on the right foot. So Dr. Preeya practices in the Dallas, like East Dallas-ish area. Is that correct?
Yes,
You want to share
exactly.
where you practice? Yeah.
Exactly. Yeah.
Perfect. And for those listening in, the only reason I know is because I got to hang out with her this past weekend, where she very graciously made like a 45-minute hike to come hang out with me so we could get some girl time. But Preeya, you are a biologic dentist. Is that right?
That is correct.
Perfect. Share with our listeners what that means and what is your treatment philosophy as it applies to treating our patients.
Great. So biological dentistry can mean a lot of things to a lot of different people. I find everybody's kind of on their own journey, just like with airway and breathing and sleep. But in the biological realm, we take our classical dental training, what we all learn in dental school, and we start to dive a little bit deeper. We want to know not just, hey, you have a cavity, you have gum disease, but why do you have a cavity? Why do you have gum disease? Why do we keep seeing you every 6 months only to diagnose the same problem again and again? So that's a key part, is looking at the root cause, trying to get to the bottom of how do we fix what's broken and try to prevent that from happening again. The other thing that we look at is trying to do it in a way that's more kind to the body, more biocompatible. How do we remove obstacles that are in the path of the body's ability to heal? And a lot of times, it's just that we've been trained to look at the teeth in isolation. And the teeth are attached to a head, to a mind, to a soul. And when we start looking at everything that's attached, changes the whole picture. And so that really ties into the airway and the breathing. And when we're seeing patients who have chronic cavities, or patients who, they brush and they floss and they use mouthwash and everything else, but they're still getting decay. And we say, well, you're lying. You're not doing good enough. You're not eating right. Well, there's more to the story than that. And, it usually just means that we have to stop. We have to listen. We have to ask more questions, and then continue to ask questions to dive in. And it's such a fulfilling way to practice, because you know that you're making a difference and taking care of patients who otherwise they just get dismissed as like they're crazy. What are they doing wrong? Obviously nothing. So it's really been a neat journey for me, and continues to be the more I learn. We, most of our baby biological dentists, if you will, begin by looking at SMART protocols. How do we safely remove mercury amalgams from the mouth? And then you start learning more about that, and go more into the root cause, into different modalities, using ozone, using alternatives to fluoride, because fluoride can actually cause precalcification of structures that, like cartilage in the body, considered a neurotoxin. There's a lot of dangers that we weren't really taught about in dental school. And when we have alternatives that don't have a lot of the same side effects, but they're just as effective, it's great to be able to use those.
Yeah. For our listeners, and I'm sure you guys have picked up on this too, that just these couple of seconds, minutes that we've been into this conversation, I heard words such as getting to the root cause, personalized care, right? Actually sitting down and asking questions and trying to understand why something is happening. I'm always fond of saying we got to turn into 2-year-olds and ask why, but why, over and over and over again, so we can actually get down to what is truly contributing to all of this that our patients are trying to help with. So obviously this entails long conversations, right? Have you, or what have you faced when you're talking to patients? Do they look at you like you're crazy? Because it's not always us looking at patients like, well, what are you talking about? Have they looked at you like you have two heads when you start to like educate them? Tell me that journey. How did that start, and how is it going?
It's, I think my husband looks at me like I have two heads half the time too. So,
well, that's his job. We're going to discount the poor man here.
Absolutely. But So when I purchased my practice back in 2018, it was a normal drill and fill and bill dental practice. I renamed it the Whole Tooth just because I liked that idea. I always looked at people holistically as a whole person. My training postdoctoral training up in Seattle was very risk-based, very whole person based training. So I had already been trained from my first year out of dental school to ask why, to really look at what are the risk factors involved and treat each patient individually. As we started to move more into that holistic realm, and even when I purchased that practice and we're asking patients about their diet and their their habits, what do they eat? What don't they eat? Do they chew food that's crunchy? Patients would be like, well, you're a dentist. Like, why are you asking me about what I eat? Why are you asking me about how I sleep? And if I snore, that's none of your business. Like, no, it's absolutely my business, because I'm going to tell you, as soon as I lay you back in my chair, I can see that you can snore, or that you snore. I can see that you've got these different challenges. Like, you don't even have to tell me, but the courtesy of asking and learning what their level of awareness is definitely, I think it's my job. But as we've attracted more holistic patients, they often come to me expecting me to ask those questions now. But certainly earlier on in the journey, it's interesting to get into the mind of the patient and what they think we do and what they think we care about. And, they'll self-select out pieces of information. And then you have to kind of tease it out because, all those tiny little puzzle pieces, when you put them together and you're like, oh, well, I mean, obviously it all makes sense. It all fits together. And they go, oh, well, I really never thought about it that way. But every day I'm always learning something from the patients and what they share with me and where they are on their holistic or biological journeys too. It always has me chasing down various rabbit holes, trying to figure out, what else do we have to learn here?
Yeah. So you mentioned airway and breathing. Now you see adults as well as children. Is that right? So I am thinking, well, I know that conversation looks different for both groups of patients. Let's put it this way. What do you look for, or, where's your mind going when you have, say, a new patient? Say you have me in the chair as a new patient. What are you screening me for? And then if I bring my children, what are you going to look for? Are there any similarities? Let's dive a little bit into airway and what that might look like for a doctor that is holistic, that actually looks at the body as a whole versus just being a tooth doctor. There's nothing wrong with being a tooth doctor. You and I look at things differently. So let's dive into that.
Absolutely. So before any new patient comes into my practice, whether they're adults or children, I always have them complete a airway screening questionnaire. That has evolved over time because none of us likes filling out paperwork, but man, the more you tell me, the more I can ask questions and put that picture and that story together. So there's an adult questionnaire that I have them complete as an adult, and a pediatric questionnaire that parents complete that I ask them to take a little time, because a lot of times as parents, we're not really observing those specific things, the habits and things that they do. So with adults, it really focuses on body systems, different things that could be signs that they have an airway breathing issue. So anything from, every system from mental, anxiety, antidepressants, or depression, to the physiological, do you wake up at night to use the restroom? Are you fall asleep right away, or are you tossing and turning at night? Has anyone ever told you snore? Lots of those kind of questions that pertain to different body systems. And then also looking at your level of fatigue. How tired are you? How does being tired affect your daily routines? And where do you think you should be at your age on a level of 0 to 10? Like, are you a normal level of fatigue? Do you feel like you are, or could we improve? Where do you want to be? And for that really gives me a sense of awareness, as well as, what other things is this person dealing with as an adult? Do you have a history of orthodontics? Have you had teeth removed in the past? Things that will predispose them to potentially having challenges with their airway, digestion issues. Everything is connected. In the chair, when we're talking one-on-one, we start talking more about, especially if we take, to back up a little bit, so we take a lot of photos out of the mouth, inside the mouth, even just tongue photos, looking at tongue posture. Can you lift your tongue up to the roof of your mouth? Does it live there? How big does it look relative to the structure that your tongue lives in that box? Can you suck it up to the roof of your mouth? Is that something that you can even conceive of doing? And all of those things open up more conversation, of course, as to why am I even looking at that? And, when you fall back in the chair, what's your tongue going to do? Am I going to be fighting it? Because
every dentist nightmare. What is the tongue going to do?
Like, can I just remove it for a minute? If that's the case, we probably have a bigger conversation here that we need to, dive into. So, from a dental standpoint too, with those adults, we're looking at, is there erosion on the teeth? Do they have a history of constantly getting cavities? Are they decay prone? Do they have a coating on their tongue or plaque buildup on their teeth? What different signs and symptoms might indicate that there's more than meets the eye? And usually as you start having those conversations, right, they open up too, and they start talking about, oh yeah, well, I always wake up at 3 a.m, can't go back to sleep. I have a bowl of cereal, and you're going, oh, okay, so a couple issues there. And then, maybe I go back to sleep, or maybe I get up and I work out because I've got to burn some extra energy, and that's their normal life. And no one has told them this is not how life needs to be, and that they might feel better if we got to the bottom of what's happening. So it's just such a fun conversation to have. You just never know where it's going to go. With kids, we go in from, I like to talk from birth history onward. So we'll talk about, was there a traumatic birth? I had a 1-year-old in this morning where we were talking about all of that stuff. Mom had read the breath book and noticed that her child was breathing through her mouth, and her pediatrician said, hey, come over, come see the whole tooth. And so we were talking about just what was the birth like? She was in labor for over 24 hours. Mom had lost a lot of blood. Baby was coated in meconium and, came out, couldn't latch, had problems with ever breastfeeding. Now she's 1, uses a pacifier, mouth breathe. She's got a lip tie like no other. And she said, well, they checked for ties, but as you and I know, we haven't been trained how to look for ties in the mouth. And if there's a restriction that keeps that lip down, how can we expect baby to feed? And so asking just that history, and for kids who are a little bit older, was there clicking when they were breastfeeding? Were they colicky? Did they spit up a lot? All of that paints the picture of who this child was and where they are and where they're going and how are they growing, and really lights up some areas where we can have a baseline and measure as we start to grow the child, to see how we get some improvements. And it's just amazing to see how lives can change.
Yeah. It's fascinating that you brought up birth trauma and such. C-sections versus vaginal births too. And yes, sometimes you can't avoid one over the other, but that directly impacts our microbiome too. Did the baby pass through the vaginal canal too? Did they need a C-section? And now, I've worked with other healthcare providers that are talking about, okay, if there is a C-section that needs to happen for whatever reason, it could be choice. We're not here judging anybody. It could be that there were other conditions that prevented it. What can we do to transfer some of that healthy bacteria to the child? There's so much that we can literally go into, and we'd never have enough time to do our consults, right?
Right.
Yeah. And then so intraorally, what are we looking for? You talked about the lip tie and a little bit about the tongue. What else do you evaluate? So you have an older child.
Mm-hmm. So we are looking from the outside in. So we're looking at posture. We're looking at even when they're sitting in the chair, are they slouched down in the chair? Or are they sitting up nice and tall? Looking at how they're breathing. Are they belly breathing? Are they closer to their chest? Are their lips apart? Is it labored? Can we hear them? Are they breathing too fast? So a lot happens before I even get into the mouth, because there's so much to see. Looking inside the mouth, we're looking at, all the things. Where do the teeth sit relative to each other? So what does their bite look like? Do they have a really deep bite? Do they have an open bite? How narrow is their jaw? How is the size of the tongue relative to the jaw? Is the box that the tongue lives in big enough, or is the tongue stuck? Looking at the tongue, how do they swallow? Does the tongue come forward? Does it rest between the teeth? Are they just wiggling around in the chair? Can they make eye contact? Do they have stuff in their mouths? Are they drooling? Are the teeth, again, coated in plaque? And if so, is that an issue of hygiene, or is that an issue with their breathing? Do they have a lot of restorations in their mouth, a lot of cavities? Is mom saying, well, they eat so well, they eat fruits and vegetables, and they don't have sweets, but then you look in their mouth and you go, okay, so what's causing the sugar bugs to attack here? Tell me
Right.
more.
What is the main diet? Is it sugar? Which obviously mom's saying it isn't, but we're looking at it going, I don't know.
I don't know.
Yeah.
Exactly.
Yeah.
Let's not balance things back out. So it's and I think you start, the more you do it, the more you see the patterns, and you don't have to necessarily, you don't go through the physical checklist as much as you do when you start. It's all kind of internalized. You're like, okay, a lot of times you go through the history, and looking in the mouth just confirms what the parents have just told you. They're picky eaters. They have a lot of gas. They
difficulties focusing, right? And those school children too.
Right.
I see that a lot. Yeah.
Yeah. And then they walk into the room and they're all over the place. And you're like, yep, that is normal. And the poor parent is just like, I'm so sorry. And it's really, it's just, we're all doing the best we can. Right. It's nothing that you can really you can't apologize for that. It's just this child is finding ways to tell us they could feel better. They may not know it, but that's all they know to do is, that they're all over the place. They lash out or they're defiant. And our job is to try and figure out why.
The why, exactly. It all comes back to the why. So obviously you have treatment protocols in place to be able to help these patients, right? Adults as well as children. Tell me a little bit about what it is that you would discuss with patients, and it could be adults, it could be kids, it could be both, as to how we can help them.
Good question. So as with most things in life, there's a treat more of the cause versus put a Band-Aid on it and manage the symptoms. And depending on where you are in your life, both are perfectly acceptable ways to go about things. I generally tell whoever I'm talking to, we did not get here overnight. So it's not something that we're just going to fix immediately. This is a journey. I am a piece of the puzzle. I'm probably not the only piece. My job is to kind of quarterback the journey and provide some guidance into where should we go next. So from a dental standpoint, looking more at root cause, we're looking at how do we treat the structure, the function, the behavior structurally? Can we create a larger space for the tongue to live in? Can we create a larger space for breath to pass, less collapse? Can we change how the tongue and the mouth function? Better swallow, better resting posture, lips together. How do we get you to breathe through your nose? And even behaviorally, what things do we need to change there? Do we need to be adding in, I lost my train of thought. So behaviorally, again, do we need to make some behavioral modifications? What do those look like? Even things like sleep hygiene. There's things that we can do that make such a quick difference that we just don't realize that kids need, stimulation at nighttime, things like that. And a
lot of times diet plays a role, right? What they're putting into their systems. Like I know we've had this conversation before, like taking away those top allergens, right? We talk to patients, let's get rid of gluten, let's get rid of dairy, let's get rid of the sugar, and not just for the cavities, but also what it does to our bodies, our brains, our gut health. Yeah. So then diving into what do vitamin D levels look like? Are we even supplementing with vitamins? Or, like you said, this is where it's time to recruit the team. Let's bring our ENTs on board, our nutritionists on board. And all of it just kind of, it's a dynamic puzzle, isn't it? Like lots of moving parts and pieces. And it's like, where do I do what? Which is the beauty. You and I get to tell, it's like we get to boss people around. You do this and you do that next. Not really, exactly.
But yeah.
Yeah.
And it's hard because as a parent, like you've got all of these other activities going on, right? But then it's a lot to handle. It's overwhelming as a parent to be like, number one, my child has a problem. Number two, you want me to see like 5 different people to take care of this. Like it's a lot. But even if you're tackling a couple of things at a time, you're going to start seeing results. Our goal is just, we want you to get to feeling better as quickly as you can so you can move on with your life and you can handle the 20 other activities that you have going on and handle just learning and being human or going to work and being able to function without having to drink 6 cups of coffee in a day.
And she says this as I'm drinking my espresso.
I was like, is she talking about It's Monday.
It's been a Monday. It's been a Monday. All good though. But I think that's the beauty of, patients seeing a provider such as the ones we have on the show, and including yourself, where we look at the patient as a whole. It's, what I call as functional dentistry. We all know about functional medicine, and functional dentistry is slowly, I see more and more docs like getting into this, and it makes me so happy because we understand it's like you don't just disconnect the mouth and walk off and go see the dentist and hand them your jaw and say, here, fix this, right? The head is connected to the rest of the body. So I think it's a lot of fun. And I know you have a lot of fun like I do, like figuring out this puzzle as to how can we help these kids. So amazing. But before we wrap up, what are your top 3 tips for parents? What would you say to a mom that's in your practice, or even me? What are your top 3 tips?
Just in general, dentistry?
In general. Yeah.
Well, the philosophy I live by, and I feel like as a parent, as an adult, Maya Angelou's quote to always, now I'm going to paraphrase the quote because it flew out of my head, but always do your best. And when you know more, do
more. Yep.
More, do better. But basically that, right? Like you always want to do your very best, but we also want to keep learning. And as we learn more, let's integrate it into our lives and do more. As a parent, don't blame yourself. A lot of people come in, or even just yourself, right? You come in with all this guilt because you're like, I've neglected my body. I have all these bad things going on. I'm afraid to hear what you have to say. And I'm a terrible person. And the bottom line is like, you are where you are. This is, again, your journey. As a parent, you do the best you can. There's no instruction manual. So, I look back on my daughter and my son and things I did then and, fast forward 7-10 years. And I'm like, well, shoot, I didn't know. Well, you can't beat yourself up over that. You just try to surround yourself with people who are smarter than you are, learn from them, and do what you can to just do your very best. So I guess that's number 1.
Yeah, I love that. Because you said it earlier too, we didn't get here overnight. And it's going to take us time to get to where we need to get. So be kind to yourself, like truly just give yourself grace and allow yourself the space to be able to get to where you need to get. I love that.
Absolutely. And, and there's course corrections along the way. That's helpful.
Yes.
3rd tip, listen. These are kind of cheesy. Listen to your gut.
That's my number 1 tip. Always to anybody. It's not cheesy. This is amazing. Yes.
Yeah. Because, when someone tells you black is white and you know in your heart that's not right, keep looking, keep asking, because chances are your gut knows more than your brain does. It really is kind of.
Oh my gosh. Yes. You know this, our listeners know this. My story about my struggle with Hashimoto's and never having answers. And I kept going back for like, I know something's wrong. I don't feel good. You got to listen to your gut. And especially when it comes to your own child, nobody knows your child better than you, right?
Absolutely.
That is so amazing. Oh, you know what I forgot? Tell us about your tea.
I was like, is she going to talk about
hoping I would forget.
So when I was in New Mexico a couple years ago, I had the most amazing massage. At the end of my massage, they handed me a cup, and I took a sip thinking it was like a cup of water, and it was the most amazing, cool water-like elixir. And I was like, I need to have this in my office, because I feel like at the end of your dental appointment, you've gone through all the things, you've got this funky mint-ish taste in your mouth. I wanted patients to leave with just a better taste in their mouth.
Palate, right?
Right. And something that was calming. And so I got in touch with the tea maker who's in New Mexico and talked with her. And we decided to come up with a line of 3 teas, Mind, Body, and Smile, which aligns with my membership program. We have a Mind, Body, Smile membership program for patients in the office. And so we have 3 different teas. 2 of them are directly from the tea maker. And then 1, we work together to create Smile. So Smile is a custom blend tea containing all sorts of ingredients that help reduce inflammation in the mouth. So it's a green tea with some peppermint and lavender and cardamom and all sorts of deliciousness that not only calms
I might need a dental appointment just to get some of this good stuff into me.
I'll send you some. But it's great. I'm trying to figure out if you could use it as like a mouth rinse if you just had like a little bottle of it tableside, but it's wonderful hot and cold and It's been really fun. Patients love it. You don't realize how many people love tea until you start offering it. And suddenly everyone, I mean, people you wouldn't even expect, they love it. So it's been really neat. I need to do more with it.
I love that thought. I mean, you truly are taking care of the whole.
Siri.
We had Siri wanting to chime in, be part of the cool club. So I love it. This is real life moms,
Right.
working moms at the end of the day, getting ready to get on other calls and looking after kids. This is as real as it gets. Thank you so much for spending your evening with me. I know I will see you in just a few minutes on another call.
Yes, this has been fun.
But yes, for our listeners, I will have all of her contact information, her social media handles. She's very active on Instagram. Go follow her at The Whole Tooth, right? Is that correct?
Yes,
That's your
at The Whole Tooth, Texas.
Texas. Do not forget the Texas. We'll have links to her website, contact information, all of the cool stuff she does. So make sure to follow her. And as always, if you live in the Dallas-Fort Worth area or know somebody there that does and needs a fabulous doctor, you know who to go to. As always, share this episode, hit that like button, hit the subscribe button, leave me a review, and I will see everybody next time.